Welcome to Killer Cure, our new podcast where we take an unfiltered look at trends, policies, and innovations shaping healthcare, investing, and everything in between. I'm Todd Perman, President and CEO of Seed Healthcare, an impact fund focused on supporting breakthrough healthcare technologies that support preventative care and early disease detection. I've spent my career at the intersection of healthcare, innovation, and capital, and I'm passionate about digging into the big questions that can shape a healthier future. This is not just another business or healthcare podcast. Each month, I'll be joined by Bill Liao, a world-renowned entrepreneur, investor, general partner, thought leader, and we'll dive into the conversations that matter. We'll pull in really, really important guests that will impact the discussion. Some will be really conservative, some will be really on the other side of it. The whole goal is to really have controversial discussions that lead and educate and process and allow us to absorb what's happening in the world and the challenges, political headwinds, financial trends, and the commentary around how we're all living our lives, and whether we're parents, whether we're not parents, what's happening, and how we travel the world, and all the broad ways that life impacts us all. We're really here to go beyond the surface, beyond the headlines, and beyond the numbers. So let's jump into our first episode.
Here's an interesting one for you, Todd. Do you take magnesium?
No, I don't.
You know, a lot of people do, right?
I do.
Yeah. What stops you from taking it? I mean, I take magnesium, but what has you not take it?
So I'm on a regimen of other supplements and a variety of things. Magnesium does contribute to good sleep, and it actually is one of the things that are noted as a positive supplement in kind of the longevity space. The way I feel when I take heavy doses of magnesium just didn't agree with me. So I phased in other components that actually worked well for me in that area.
So was it the laxative effect?
No, the pooping was fine. I appreciate the personal nature of the discussion. I did not have a laxative effect. I had more of a grogginess in the morning. It didn't make me feel like I woke up clean and fresh. Not to have a pun against the other excretions you were talking about. So that's why magnesium just didn't work in my regimen. I think it's been positive for others. And certainly if you're working on your sleep, magnesium is known to be a good positive influence in that area.
So I find magnesium really helpful for my muscles. When I exercise without magnesium, I tend to get more muscle aches and pains. When I have some magnesium, tends to get rid of that. And I also found the grogginess thing, which means I take my magnesium earlier in the day. So I take it several hours before bed, and it really helps my deep sleep. There is the cure part. Did you know that magnesium has a kill part?
No, Bill, tell us what is magnesium? Who's it killing?
So here's the thing. If you take a huge amount of it, like 5 grams a day, it can be toxic in and of itself, but you're super unlikely to take 5 grams of magnesium. But like if you go to, I don't know, Google, and you Google the top recommended result for magnesium, one of the likely things you're going to see, I'm not going to talk about brand names, but you're going to see a supplement that claims very strongly to be absorbed more readily because it's a combination of magnesium and vitamin B6. And that's true. Vitamin B6 helps you absorb magnesium. And vitamin B6 is also, good for other stuff. Just one little problem. If you hit 100 mg of B6 a day and you take that every day, you can develop neuropathy and brain damage that may be irreversible. Now, you'd think 100 mg, that's, a lot. For the top Google search brand, it's just 4 doses gets you to 100. And like people think, oh, magnesium, 4 doses, that's way below the toxicity level of magnesium in the supplement. But it's right over the top of the vitamin B6 toxicity. And there's actually people on the internet right now decrying this because they've ruined their lives through over supplementation of B6. And if you just take some magnesium and okay, you're under the dose, but then maybe you're taking a multivitamin that could have B6 in it as well.
It definitely does.
And there are
Yep.
foods fortified by B6. So, like on the kill side, vitamins are questionable on the cure side for a lot of things. On the kill side, they're absolutely potentially deadly if you don't look at the labels. And you'd ask yourself, why would you get so much of a dose out of a supplement, a vitamin supplement? And the answer is most of the supplements are dosed in order to get you out of deficiency as fast as possible. So they are close to the line. So again, it's all about finding that balance. I think one of the themes that we're going to have throughout this entire podcast is where is the balance? Where is it like
Of doing something versus doing nothing.
well, doing enough of something and not too much.
Yeah, I agree. I think that'll be a frequent topic. I mean, as an example, when you think about what people talk about publicly around diagnostics in heart health,
Yep.
people have long been raving about how important a cardiac calcium score is, and there's a lot of myths associated with that. I don't know if you've been following it, but when you start to look at hard plaque, it is an indicator that you had plaque. It is, however, a misleading indicator of what your current state of heart disease is. There's enough technology now to measure actual heart disease based on an AI analysis with a CTA and other processes that really do tell you, well, how much blockage in a specific artery, how much inflammation do you have, those types of things. And it's far surpassing, what's been touted as positive results. And I had a calcium score years ago, and it was 0, and it was still 0 recently. However, I had minor blockage in 2 of my arteries. Not significant, but it allowed me to actually see it, feel it, touch it, and then reverse it, and invest in time and energy supplements that would actually help it be reversionary, that most people really aren't aware of.
And when you say reverse, were you converting that soft plaque to hard plaque and therefore increasing your calcium score?
I was taking soft plaque and converting it to hard plaque, so increasing the calcium score that was 0, but decreasing my stenosis in the arteries that were affected. And you can do that through a multitude of ways. Some people use statins, some people use a lot of heavy fish oils to flush out some of that. And there's a variety of new things coming that we're definitely going to talk about here. Revolutionary new therapeutics, things that are very disruptive to kind of the chronic condition of heart disease.
And would you say that the calcium score got to prominence because it's the easy thing to measure?
I would say it's easy, fast, and inexpensive. It's just a completely misleading, directive, because you could have a 0 calcium score like I did and actually have some blockage or even really further significant blockage. The same correlation with cholesterol is kind of the misleading directive that the American Heart Association kind of claims as, here are the benchmarks, look at your hard plaque, look at your cholesterol, and actually you've got good indicators of heart disease. Whereas, that's been really kind of busted. And you can look at where the inflammation comes from in your vessels and why. And a lot of that is driven by even sugar and A1C. And some of the trends that we've seen in the data are that you can almost disregard cholesterol and disregard, your hard plaque score.
Well, that's another balancing, right? Because good cholesterol, bad cholesterol, it's all necessary for life. You actually have to have enough cholesterol to live because it's used in everything from your kidneys to your hearing. And so if you strip out all the cholesterol, which people think, oh, well, let's just get rid of all cholesterol. No, that means you die.
Yep.
So there you go, straight back into the kill. So it's like finding the balance is always tough. And epidemiology isn't a great way to find the balance, it seems.
True. I think the way to find the balance is actually know where you are currently and really dive deep into the diagnostic processes and then do interventions that are process oriented that lead you to track what effect it's having, what the outcomes are, and how you go. That's the cure part is start with a baseline, start with where your hormones are, start with where your cardiac output is and your actual stenosis is, depending on your age and history and all of that, those types of things. Look at cancers and make sure you don't have any. Things like that, like eliminate the big risks in all areas: metabolic health, heart disease, cancer, and brain health. Right? If you can do all of those things, you've kind of got to lead into being cured of 85 to 90% of the things that could be affecting you, and then you lean into what do you really have to go do next? What's the next right thing?
Yeah, that's all great. The average person can't afford that, though, can they? Right
It's
now.
it's getting there. There's variety of scans that can be done at a low cost. I'd say that there are affluent programs. I think that's part of our discussion points. Like, how do you democratize this for the world? Ultimately, and how do you get it embedded into the fabric of the payer system, regardless of the country, right? Each payer system has its own problems. So you have to look at how you democratize it and driving the cost down, whether it be for even a simple blood test, all the way through to full on imaging and scans and MRIs and things that will diagnose, cancer risk, and actually really catch that disease early. It really is a shifting paradigm to where the technology is getting better and better. It's getting more accessible. You have to start somewhere and then drive the cost down to where it's more affordable to the masses and the population, and then fit it into the payer model. That's where I see a lot of the trends in preventative care moving in the next 3 to 5 years as things in the U.S. change. The new, like it or not, the new politics might have an impact there. There's a lot of awareness around preventative care. I think that's the trend. It's democratization, and how do you get there? How do you bring the cost down? And you, as a commercialized investor, understand probably as well as anyone how you really drive change and bandwidth around cost and cost reduction when you scale a big business.
Still, I get all that. And where does somebody go to get a low cost cardiac evaluation that will tell them what the real blockages are? I mean, it uses the technology uses AI, right? So you've got to
It
have a
does.
CT scan and it's got to be analyzed by an AI, right?
Yep.
So
There's
where
a
does
few
someone go?
companies that can do that. I go to Fountain Life. That's one of our companies. However, there's a tremendous amount of ability to go to your normal doctor and ask for a CTA with an AI analysis. That test total cost is between $1,500 and $2,800. Will it be reimbursed by insurance in the U.S. as an example? No, they do not see it as a screening test, unfortunately yet. I think eventually it should be. They'll help support your calcium score, which doesn't tell you anything, but they won't do this. So from my standpoint, I think it's a combination of payer challenge and the access, and what the incentive is for the providers to actually order the test in the first place. So if you go to an interventional cardiologist and you ask them for this test, they likely won't order it. If you go to a primary care doctor and you say, this is a test I want, and this is how you're going to go about it, and this is why, you can get access, and they don't have misaligned incentives with diagnosing your heart disease.
So
Whereas
$1,500 is a lot of money. Right? For a lot of people, that's a lot of money.
I understand.
So when should someone do that test, do you think? Like do they wait until they're 45? Are they, if they're type 2 diabetic or a pre-diabetic, do they rush off? Like, because you're probably going to have to save up for it.
You might have to save up for it. You also, have to look at, well, what are your hereditary risks? I'd say that's one indicator. So you kind of shift it from everybody getting one to who has hereditary history. What is their age range that history actually showed its head? Like a lot of us have parents. My mother actually had heart disease at 53 and didn't know she had it. Ended up with a quadruple bypass. My father actually had late stage cancer and didn't know it. And that was another detection. That's why I'm so focused on preventative care and am proactive. So when I started to get into my 40s, I started looking at, well, what are my real precautionary measures that I should take? And am I willing to invest in that? And I decided to invest in that, right? It's a decision that we all have. And some people actually keep their head in the sand and don't want to know. I know that
Oh,
there's
I
things.
love keeping my head in the sand.
Well, there's
It's a weird
different
mix,
reasons
but
that you might like that, Bill. I'm not going to go there right now, but
a lot of hypochondriacs love to keep their head in the sand because false diagnosis is a lot of pain.
it is, and it's a lot of mental gymnastics, right? It's a
Oh yeah.
lot better when you actually know I have 30% stenosis in my main left coronary artery. What can I do about it? How can I measure it and reverse that? And I know you said $1,500 is a lot of money to a lot of people, and I totally get that. And at the same time, I would say, if you really look at the risks of heart disease, which kill 18 million people a year, right? And they kill them with one heart attack. Most people's one heart attack is their last one, right?
Yeah.
So if you think about the things that can kill
It's
us,
like the
and that
first time your parachute doesn't open. It's
exactly,
probably the
and
last time.
well, fortunately, you have a backup parachute, so a percentage of those people live. But
Yeah.
there's, as somebody that has jumped out of a plane, which was probably foolish in my 20s, you think about, like, you have a backup plan. In heart disease, often there is not one. And if you're not near a hospital, you don't get lucky, you don't get the right ambulance, you don't get the right, care or delivery of care in that moment, you're dead, right? And frankly,
Yep.
that's not an option I'm willing to take, based on what I've invested in, my time, my life, my kids, and looking forward, my perspective is invest in my health preventatively and make sure that I can lean into my year fitness wise, in every aspect, with a real proactive nature. And if I do that, then I'm doing the best I can and creating as much muscle, everything that goes into what my healthy being is and what a healthy lifespan is. I think that that's how I've looked at creating longevity. If I don't die of those top 5 killers, then I'm ahead of the game, right? That doesn't mean I'm going to live till 150. It just means I'm going to be ahead of the game,
Oh,
and
thank goodness
ideally,
for that.
yeah, that would 150 would be a while, yeah. Then I'd only be a little more than a third done. I mean, that'd be great.
uh,
The world
great
can
for
handle
you.
that, Bill. The world can handle it.
I'm not sure I can, but yeah,
Well, it depends on how long you live.
yeah, exactly. That's always the worry,
It sure is. It sure is.
especially in a world where population um, growth is decelerating everywhere.
I think that's a great topic to cover. I'd say, with all of our travels, like, let's see, I've been in 10 countries in the last year, and experiencing all of the different nuances of the payer system, understanding what they think is great healthcare, like the NHS. Oh, it's amazing, right? And then you start diving in, and there's a very national perspective of healthcare in each community. Oh, everything's great in the UK. I get all my care for free, and I get all of this, and I get all of that. And then you start asking questions, and you start to see that it's really the same system with a different wrapper and a different payer model. And when I looked at all of the different countries, Japan, people lined up after I spoke saying, hey, can you keep our old people alive? Right? Like, that's something that simple. And the catalyst of and thought of preventative care is so backward minded to the current healthcare systems everywhere that
Yeah.
that it's just simply not addressed, and it's not paid for, and it's not incentivized, and it's completely misaligned. So same thing in the US. I'm not picking on everywhere else in the world. I'm picking on kind of the entire world ecosystem around healthcare. It's a break fix model, and it's got to change.
Yeah, I agree it has to change. I'm not going to complain too much about the NHS though, because my recent visit there, while it took it forever and while it was not pleasant, it was free.
Yes, and if I recall, an overnight, in the emergency room, yeah, it was
Oh
free.
no,
It
no,
was,
they actually found me a bed at one point. I was impressed.
yeah,
And
and you made
if
it to
I'd
the
done the
meeting the
same
next
thing,
morning. That was even more impressive, actually.
yeah, yeah. And having done the same thing in the US, I know that my insurer in the US was billed like 25 grand for the same experience. And
Definitely,
the only difference really was the speed at which I was seen.
I could see that. I could also see, well, and that's indicative of the sick care system worldwide, right? They're going to
Yeah.
do the same things, right? While they were there spending all that money, couldn't they have done some things that would have actually taken it to the preventative directive so that you don't end up
Oh
back
yeah.
there again? That they probably didn't do. And I can't tell you what the tests were, what they did do, or what they didn't do. The difference between, a cardiac, a CT scan when you come into the ED, which is everybody gets one, and a cardiac related CTA with an AI overlay is fractional. Like the amount of
Yeah.
difference in cost is fractional, right? So
Yeah.
why not do the real invasive, diagnostics that create that preventative directive instead of just saying, okay, you're having palpitations, your heart rate is accelerated, what's happening? Instead of doing just the basics to say, okay, you're not going to die right now, right? And that it's going to
Yeah.
go away, or that it did go away. Why not just invest a little bit more and get a lot further with where you go on a roadmap with your health from there? Not
Sure.
picking on your
And I
health,
mean,
just simply saying
as you
that's part of the problem.
as you said, it's the sick care system rather than the healthcare system. And the incentives seem to be backwards.
Right. Right. I haven't found a country that the incentives are completely aligned, where the payers, the providers, and everybody's rowing the boat in the same direction around keeping you healthy, or even manufacturing a healthier version of you. It's
Yeah.
what is the symptom? What are we treating tangibly? What can we do in this next 20 minutes to actually take care of that and leave you better than we found you? That's it. It's a completely broken aspect of the system where there's no alignment with, how do we really create a journey where you're going to create health and wellness and proactive care? There's talk of it happening in the US with Medicare. I think that's the shift in 2030 that everybody's talking about. We'll see what this new leadership team in the US actually takes steps on. I know it's a hot topic for you. I don't know if that even counts as a hot take. That's more like a fire take for Bill. I know.
I mean, the hot
So,
take the hot take is there going to be Medicare by 2030?
according to the value-based care trends and the direction, and what every regime has said for the last 6 in the US, is the Medicare population will go on full risk by 2030. Whether that stays in the next year or two, or it gets revised, that'll be really interesting. And you're spot on. Will it run out of money? I mean, can they afford it? I don't think they can't afford to shift to more of a risk-based model with more preventative care aspects. That's the thing. If you look at the $5 trillion spent in the U.S., I'm rounding up, a hundred, rounding error, right?
Yep.
4.9 trillion. When you think about it, if you just took a fraction of that and invested it in preventative care instead of sick care, how many disease states would you catch earlier, and how much lower would the cost be to treat those? And how much would it bring I'm not a rocket scientist, but when you bring the math forward, it may take some time and investment. the long game is it reduces the cost by catching it early. It's just that simple.
Sure. I mean,
And
I would say that $6 billion annually spent purely on prevention would make order of magnitude difference on the other side, on the back end in terms of cost,
I
which
agree.
happens to be the amount that the US subsidizes all the oil companies annually.
There's definitely
Double
some
win.
there's definitely some connectivity there. I think an ounce of prevention goes a long way, right? So
Yeah.
when you look at the economics of the spend, you might not see it in year one or year two. It's really the trending and the direction around it, and there has to be a commitment to preventing disease and catching it early. It just there has to be. That's worldwide. The only way you keep people alive longer and stop or slow the declining population, or even better yet, start to really create momentum in the younger population to procreate even more, right? Which will help that as well, is have a happier and healthier lifestyle that also includes preventative care to make sure that they're healthy enough to procreate, right? There's a lot of challenges with infertility in the world. Some people have babies, no problem. A lot of people don't. So some of that is
Well,
environmental,
a
some of
lot
it
of people have to
hereditary.
wait
What's that?
so long before they can have a child. Like, yeah, if you're a Walmart greeter,
Yep.
you probably can't get by without 2 jobs and food stamps. So how are you going to have a child, let alone do preventative healthcare?
Well, how about how do you have a child that is not a product of the state?
Yeah,
Right? Like in the US, it's different than the individual countries, but you look at Medicare, Medicaid, and you look at the support of and the people that are procreating. Often there's a financial burden that they just can't handle, right?
yeah,
I totally agree with you. So you have to have multiple jobs, and then what happens, right? You neglect
yeah.
other challenges. You become a product of the state. You become a deficient person in a healthcare environment. You're not taking care of yourself. You're not taking care of your child. Nutrition, all the things that feed into, how do you actually grow a healthy human being? Well, you need all of those things, right? And from my perspective, doing it on a shoestring budget is a challenge. So I understand the risks and why population is declining, right? People aren't making as much money, they don't have as much footing, and they're not ready to have kids until later in life. Then it's too hard, and that's why infertility numbers are higher. The challenges of that. So I totally agree with you.
And like, let's say somebody is really wealthy and they have a prolific number of kids. You know, if in when those kids hit the workforce, if there aren't sufficient other humans to keep the machinery running, even the wealthiest of wealthy people's kids aren't going to have a lot of fun if there are no other people around.
This is true. Well, if you look at the education system, which I know is something you're passionate about,
Yeah.
kids are now being homeschooled a lot more, right? That infrastructure didn't exist in the U.S. as much years ago. Now it's really prevalent, and I think the challenges of COVID and how the education system dealt with that, and the environmental aspects combined with the lack of actual education, right? Is part of the challenge, and the response to that is, well, we'll just do it ourselves. I do think there's a huge amount of need for parental responsibility and ownership, but the socialization of and controversy around homeschooling versus not, and how the kids get educated and where their socialization is, right, is definitely a
Well,
factor.
let's just unpack that for a second. Socialization of homeschooled children tends to be significantly better than socialization of kids at school, in terms of every metric you care about, including the ability to hold a conversation, the ability to fall in love, the ability to have, rational dialogue. All these things are better for homeschooled kids, even ones that are raised in extreme Christian or extreme religious homeschooling tend to have better social skills, which is the polar opposite from what people imagine. Um, the reality is that one bad social incident in a school playground ruins a bunch of kids anyway. from their socialization perspective. And so the hazards of the school system social application everywhere from socialization perspective far outweigh the benefits from a socialization perspective. And then add on top of that, that in a bunch of schools in the US, you're also having regular shooter drills.
Yeah.
Like, I got to tell you, chance of my kids, who I did homeschool, getting shot, very low. Chance of the average school kid getting shot in the US should be zero, and it's not.
Yep.
So
I
there's a
agree with
lot
that.
to unpack there in terms of socialization, the education system's impact on socialization. Um, in terms of where mental health comes in, there's far more damage done to socialization from phones and scrolling
I
than there
agree.
is from any kind of education
I
that exists.
I totally agree with you. My kids were public school kids. I actually, they've done really, really well. I've been very fortunate. Uh, However, even in that system, in an affluent area, there was bullying and different things that came across that as a parent you want to protect your kids from, because those scars can really lead to real challenges. And I totally agree with you. The thing that you have to do, notwithstanding that, right? You can't take every kid out of the system and protect them from that. They have to actually remember who they are and where they're coming from. And it's likely something you embedded in your kids in the fabric of their homeschooling, meaning, right? Their focus, their knowledge base, their gifts and strengths and weaknesses and challenges and opportunities, right? Like, so you've emblazoned that in them to be able to drive towards that. I'm not going to tell you how you did that. You did it your own way. I probably did it my own way, but reminding them how and what and who they are, I think, is where a lot of kids get lost, and they get lost in social media. And I think that's affecting their health. I think you're spot on there. When you do tests of kids that are in their 20s and you start looking at, well, how are their hormones affected by social media and by all the things that are dragged into, the phone, just what goes through the phone, all of the positives and negatives and access and information and all the things that affect them, it's absolutely affecting this younger generation around hormones, on directives. It's affecting them at a younger age than we were affected, right? It's a completely different environment today. So even your young 20 somethings need to be tested to make sure that they're aligned with a health journey that actually fits what's going on with them. So it goes back, I know it went full circle, but it goes back to, like, know your baseline, know where you're at, and then do the right things that actually support your health. And that could be putting your phone down. That's simple, right? It could be, where you're getting educated and all the things that go into it.
Simple. Putting your phone down for the average human today in the world is far from a simple task
It
now,
is. It
and
is.
it's getting harder. Like, if you have a really, like, I know of people who have intimate relationships with the AI on their phone now,
Yeah,
and like that is such an own goal.
it is. It is. It starts crawl, walk, run, right? You have to start with your crawling, which means you put it down a small percentage. You start walking, you start to feel a difference, and that actually helps you with that. I think the mental health component of where things are going, and how the phone and how the communication systems are integrated and how social media creates all of those interactions. I think all of those things have a huge tie into the future health of every country and really all aspects of the world. So
Yeah.
they're all relevant topics here.
And you would think that if you said, okay, if the step counter on your phone is not going up, then then you shouldn't be able to access it for social media, right? And then what you have is people walking around neighborhoods with their nose buried in their phone getting hit by cars. So so that And so
that would
then
be dying of something stupid. That would be stupid, right?
exactly. And yet it happens. There's a non-zero number of people who die from literally that.
Right.
And then you got to ask, because they want to do their steps and they want to browse social media, and they're doing both things, like I am right now, walking and talking, right? Except unlikely to get hit by a car in my office. And yet that's what's happening. It is actually like, that's a stupid way to die, and yet people are dying that way. Pretty much everyone has a phone these days. So, and the phones know where they are. So you should be able to predict, like the algorithms should be able to predict when somebody's about to step out in front of a car, and they should be able to warn them because their attention is on the device, right? That no one is doing that at all, to me, is kind of crazy. Because again, that's an easy way to die. That's a stupid way to die. That is super easily preventable if you understand the technology, and yet no one's doing it.
Yeah, that's a
Talk about prevention, right?
well. That sounds like a startup waiting to happen, Bill.
Safe walking.
Safe walking app. You know,
Yeah, exactly.
don't walk into that pole. Stop.
Yeah. But at least, look for the fast-moving Bluetooth signals around you and go, maybe I shouldn't cross this road just yet.
Yeah, I get it. I think that's a definite could be a good winner. I think you should take that through the accelerator process, right? See how that gets there. Thanks for joining us for this month's Killer Cure podcast. We're really just getting started, and we've got some incredible conversations coming up. Expect to hear from visionaries across a variety of fields: founders, physicians, investors, politicians, really world leaders. We're talking about everything from cutting-edge health tech and longevity to the political and economic shifts shaping our future, which there's a ton going on right now. Whether it's a breakthrough that cures or a killer investment, we're here to unpack what's real, what's next. So be sure to follow along, and we'll be back next month with more unfiltered insights on living longer and investing smarter.